At Cook Children's, we've made a promise to improve the lives of every child in our region. Our promise means bringing innovative breakthroughs and family-centered care to all of our patients. We often start with the littlest babies in our newborn intensive care unit. These babies need specialized care in a warm and inviting place where the whole family can heal together. It gives them a new beginning, the chance to begin their experience as a family sooner.
It's the unit of miracles. I don't know any other way to say it. We have interventions and specialists and procedures that we can do to make the impossible possible sometimes.
My favorite part about working in the Cook Children's NICU is really helping to take care of not just the babies, but also the families that come to us. Whenever a child or an infant's admitted to the hospital, the whole family's admitted to the hospital.
When I take care of a patient, I take care of them as if they were my son or daughter.
I love children. I love newborns, but I also love critical care medicine.
Aside from a baby still being in the womb with the mom, and aside from being at home healthy and strong and thriving, that it's probably the next best place for them.
I found out that my son William was going to need help from Cook Children's as soon as the whole birth process started. William was a perfectly normal pregnancy. We had no warning. All of the tests came out perfect. There was no reason to think that there was anything wrong. We ended up in an emergency cesarean situation at 34 weeks. I was taken to a local hospital, and after William was delivered, it was very obvious that he needed a neonatologist badly. I'm a first-time mom, and I put my first-time mom pants on, and I looked at her and I said, well, are you the best or not? And she said, we need to get him to Cook Children's. And so a transport team was called. They arrived with this large isolette that looked like it could take a bomb. So I felt really prepared to hand my son over. And I pulled one of them aside and I said, I need you to understand that I'm giving you my baby. So I want you to know that you're taking my place. And she said, I will take care of your son like he's my own. And I will call you personally if there's a problem. And so I felt confident handing over my most precious gift to somebody who had instantly earned my trust. I was broken. The umbilical cord couldn't stretch far enough. It was difficult to be brave. Once treatment started, we had glimpses of hope every time the physician would call. The phone calls closed the distance between my son and I. Our values and our beliefs were taken into consideration. I was listened to and allowed to participate in his care. One of my favorite memories was the first time I held William. I hadn't held him in 4 weeks, and a physical therapist came up and asked me, have you held your baby yet? And I teared up because there's a ventilator and there's IV lines and monitors. How can I hold this baby with all of these things? And she said, we'll take care of it. And so I sat down in a chair and the physical therapist and the nurse handed me my baby. And we snuggled, and it was so intimate and warm and beautiful. The staff made sure that there were no interruptions, that I just got to be a mom. The nurses and physicians at Cook Children's did the rest.
What sets Cook Children's NICU apart from other NICUs is the fact that it is located in a children's hospital. A neonatal intensive care unit cannot function well without support staff. We understand that every baby is different. We're able to provide subspecialized care for each unique diagnosis. We could not do that without the Children's Hospital, because it's not just the Neonatal Intensive Care Unit, it's the Neonatal Intensive Care Unit in collaboration with the Children's Hospital and the dedicated staff and dedicated subspecialty staff that makes that all come together.
Our NICU is what we call a level 3C NICU. We get many of our babies from other NICUs, and we do that because we have subspecialties. We have the pediatric cardiologist, we have the pediatric surgeon, we have the pediatric pulmonologist, all things that a normal adult hospital does not have. A level 3C means that we can take care of pretty much everything. We have the ability to do ECMO, which is extracorporeal membrane oxygenation. We are the only NICU in Tarrant County that can do that. The other thing that we do is cooling. We cool the babies down and we help to minimize some of that brain damage that can occur. The other thing that we do is nitric oxide administration, and it helps open up their lungs. Those are three things that are very unique to Cook Children's, in addition to having all the subspecialties and all the other services.
Now the room can be configured, the single patient room can be configured to address how ill the patient is. And so as the patient convalesces and gets better, we just change the configuration of the room, but we will not be moving the patient. So it lends itself to less errors when it comes to medications, treatments, and it really is a safer way to deliver complex care.
We designed the NICU not around the nurse. We designed it, number one, for patient safety, and number two, for the family. We designed it for developmental care for the baby. And it's very important that a newborn baby, especially one that is very critically ill or very tiny, is not exposed to a lot of bright lights and a lot of loud noises. The trash and the laundry is emptied from the outside, so housekeeping doesn't have to come in and do it in here. Our plastic bags that we use are not the soft ones, they're those crinkly ones, and when you snap it open, that's not good for our babies. And research over the years has shown that those babies have better developmental outcomes.
The patient rooms have accommodations to sleep 2 people. There are storage facilities within the room so that the parents can store all of their belongings. Families have access to laundry facilities, shower facilities. We have a family lounge for parents to have time away from the baby to eat or, socialize with other families. There is a lot more just quiet for our patients. It's going to be great for the patient's duration of the stay as far as infection control goes. They will, like I said, be admitted and discharged from the same area.
We have rooms, special rooms that we've designated for multiple babies. So as a parent, all 4 of your babies, all 3 of your babies, all 2 of your babies will be together in the same room throughout the hospitalization. And it really promotes that bonding experience, the family experience, because everybody's excited when there's more than one baby.
The single room unit definitely helps the family bond better. It allows the parents to be present on a daily basis to care for their child. We encourage the siblings to be present so that they can understand that they do have a baby, brother or sister that's in a hospital environment, but it's going to be okay. It allows the family to feel like a family.
When you're treating a baby, that's not the only patient you really have. I mean, you've got parents, you've got grandparents, extended families and friends. And I think we offer, it's like a family atmosphere.
All of these specialized cares really are in the context of really family-centered care, where the nursing staff, we have dedicated child life specialists in addition to the nursing staff. And that's a unique thing at a children's hospital, where a whole department is just dedicated to understanding the needs of the patient and the family, and then also the siblings are taken care of by this special department. The collaboration between the doctors of different specialty and the nursing is unique at Cook Children's because we have a direct communication and a direct connection. So for example, on some of our sickest patients, the kids with congenital heart problems, we have a multidisciplinary team that rounds each day and creates a plan for these children.
One patient may have literally 20, 30 people that are coordinating and collaborating in on their care and making joint decisions on the course of their care. And the neat thing is that we're all individuals and we're all somewhat experts in our field.
The attending physicians interact with the family directly, and it gets all the information from the person creating the plan for their child.
And because of the ability for us to work together as a team, I think that decreases the amount of time that a baby has to stay. I think that the patients get a more well-rounded amount of care.
Our Teddy Bear Air Transport is the only transport team in the country that is totally dedicated to pediatric care. We have a pediatric team and we have a neonatal team. The transport team calls in during the transport, talks to the physician, tells us everything about your baby so that when your baby arrives in our NICU, we already know what your baby needs. A lot of the medications, a lot of that stuff has already been ordered. Your bed's ready, your room's ready, we're ready to take care of your baby.
In our unit, the parents can perform something called kangaroo care. And kangaroo care is basically skin-to-skin contact between the parent, the mother or father, and their baby. We have little harnesses called the Joey jersey, and it's a little device that we use to help support the hoses and wires and things that sometimes accompany the patients when they're at skin-to-skin contact with the parents. There's been numerous documented and researched benefits out of that skin-to-skin contact.
We have milk warmers in our neonatal ICU, and they warm the milk, and as they warm the milk, they vibrate so that they help mix it. It's very important that when you have breast milk that you don't shake it vigorously, because it does break down the live cells and the protection and immunity as it gets to the baby.
I think we're one of 3 in the country that has its own breast milk bank within the unit.
In the milk bank, we do give moms labels. They will bring it in and into the milk bank with that specific label on it. It'll be processed with the same barcode. It'll go all the way through the system to the baby with that same barcode number. And so it's really safe. We can ensure that the baby gets the right mom's milk.
The most important thing that a parent needs to know when their baby is first admitted to our NICU is that we are able to offer services to their family, and we're going to take care of them. And the most important thing that they need to know is there are social workers, chaplains, child life specialists, just a variety of staff members there to help them. I don't know of many other places that consider a mother or a father actually a part of the team. We don't consider parents visitors. This is your baby that we are taking care of. And so you're not visitors in our hospital. You're actually, you're a part of our team.
When we are setting a patient up to be discharged and go home, we want to set them up for success.
We want their time in the Neonatal Intensive Care Unit to be an easy transition and become prepared for that baby to come home.
We want to do all that we can to really help them feel comfortable and in control, to know what to do through what's predictable, in their baby's day. But then also we want to help them be ready for what isn't expected so that they can still be successful at home.
Our staff toured many NICUs around the country. We've read every article on single room design to make sure that all those best practices and other people's experiences were incorporated into not only the design of the unit, but the workflow of the unit and the way the care is provided. The administration at Cook Children's has been very forward-thinking in saying these are things we need to do for our NICU to make it the best in the country. And we think we do have one of the best NICUs in the country.
Everyone involved in the care of our patients, they have a certain affinity for babies and children in general. They have a certain calling to be in that population, and I really feel like it makes a difference.
Cook Children's is an amazing place to be. It is the only place I ever wanted to be as a nurse, and I'm very privileged to be an employee here.
I would encourage any parent who knows their child is going to need a NICU to support them, or a parent who's in an emergency situation like I was, to really consider Cook Children's. The physicians are fantastic. The nurses are superior beyond imagination. They are my heroes. Everything about Cook Children's made me feel like something good was going to happen, and it did.
The Cook Children's Neonatal Intensive Care Unit, a place of endless possibilities for new beginnings.